This is Delhi. Please stand by for the next broadcast. This is Akashvani. Today, in the National Program of Features, we bring to you a feature titled Silent Struggles, PCOS and its Impact on Emotional and Mental Health. The radio feature will delve into the physical, emotional, and mental challenges faced by those living with PCOS, shedding light on how the emotional and mental impact of PCOS is often misunderstood and overlooked.
At 16 years of age, Swati noticed she was rapidly gaining weight, which, despite all her efforts, seemed impossible to lose. Coupled with an irregular menstrual cycle and the early signs of excess hair growth on her face, she asked her mother to take her to their local doctor. After a number of blood tests, Swati was diagnosed with polycystic ovarian syndrome, PCOS. Now 27, Swati has struggled with self-confidence since being diagnosed.
Occasionally, people would tell me that I had something on my chin without realizing that it was hair growth, and it would make me extremely uncomfortable and upset. I have grown to be comfortable around my family with the excess hair because they understand. However, I refuse to go to work or anywhere else without it being shaved or waxed. There's nothing more unwomanly than having to shave your face every day and struggling to do one of the primary things women were designed to do, having a baby.
So, what is PCOS and how does it affect a woman's health? Polycystic ovarian syndrome, or PCOS, is a complex condition characterized by elevated androgen levels, a male sex hormone capable of developing and maintaining masculine characteristics in reproductive tissues. It can result in menstrual irregularities and small cysts on one or both ovaries, the female reproductive organs. PCOS is a hormonal disorder with the potential to lead to various diseases. It also continues to be a common cause of infertility among women. Let us learn more about the syndrome from Dr. Priya Selvaraj, the director of GG Hospital, Chennai, and a senior consultant in obstetrics and gynecology.
This condition can be present in a wide variety of age groups. So it can be an adolescent girl that's suffering from polycystic ovarian syndrome. It can transcend into her reproductive age group in her 20s and early 30s. It can carry on until her perimenopause. And eventually the consequences of an untreated condition can go on into the menopausal era also, in which case the problem related to menstrual cycles will cease, but other metabolic complications can persist.
More often, people get confused between polycystic ovarian disease, PCOD, and polycystic ovarian syndrome, PCOS. Though some of the symptoms may overlap, they are not the same. Explaining the difference, Dr. Priya says,
there are two terminologies which people often confuse. One is PCOS and the other is PCOD. I don't like to term anything as a disease because when you look at a condition like polycystic ovarian syndrome, a syndrome means it's a collection of signs and symptoms. So how can we attribute it to a disease? Disease is something the patient suffers with consequences. So here it's a syndrome complex. It's composed of symptoms. Patient comes to you with certain complaints. You diagnose it by eliciting certain signs by a physical exam. So this signs and symptoms, when it's put together, you get a syndrome complex. PCOD can be in the background, or it should actually not come at all into the picture because it often causes confusion. And when you Google these terms, it's even worse because it puts certain signs and symptoms in a bracket and another certain signs and symptoms in this bracket. So people get confused. So what am I really suffering from?
In many cultures, discussions about menstruation, fertility, and hormonal issues are still considered a taboo. This cultural silence contributes to lack of open conversation about PCOS, preventing awareness from spreading. Let us learn more about the symptoms of this syndrome.
You have the obese people and you have the lean-bodied PCOS. So in the obese individuals, you normally have metabolic and endocrine issues. So they may simultaneously have thyroid disorders. They have hyperpigmentation, discoloration. They have male pattern of hair growth, which is called hirsutism. They also will have like a hump at the base of the neck. They also have striae, that is, your stretch marks in common terms. So they have other things like high cholesterol to deal with and diabetes, hypertension, so many things. The lean-bodied also will have similar dilemmas, but less involving the physical characteristics because they are lean. But they can have symptoms of hirsutism, that is excessive hair growth, which is another problem for them. So physically, there is a body dysmorphism that they are facing. So when you look in the mirror, you do feel awkward. It does affect you. And especially women getting in the reproductive age group who are looking out for partners, who are going to get married. So these are the issues that play on them. And not only this, they feel physically unwell because if they are overweight, they are not physically fit enough to do the chores. They don't have inclination to do workouts. They feel lethargic, tired, fatigued. And, when it comes to fertility side, it's another ballgame altogether because, they face the trauma of childlessness. They face the social stigma. They are also burdened with family responsibilities and chores in the household and the financial burden, coming for treatment. So it's a lot of things playing on their well-being, especially the mental health.
According to reports, PCOS can be described as an oligogenic disorder in which the interaction of a number of genetic, lifestyle, and environmental factors determine the heterogeneous, clinical, and biochemical phenotype of the syndrome. Further on this, Dr. Priya says,
PCOS can have a genetic and environmental involvement. So if it's genetics, you have around 41 genes which can be involved in the syndrome complex. There's an insulin receptor defect. There's also a cholesterol-related metabolism defect. So when these happen, there is a whole interplay of endocrine issues coupled with metabolic issues. So what happens to the woman is normally she gains weight. The weight will be related to high cholesterol. And on the other side, her insulin is spiking in her blood levels because there is a receptor defect. It does not go and sit in the organs it is supposed to and do its work. So all these will affect our sex hormones. So when our sex hormones are affected, there is a problem with the basic ovulation. We all are born with female and male hormones, but they are in a different ratio, which is why we are females and they are males. So when there is a reversal of these ratios and when there are circulating hormones of testosterone, which are high in the body, then you get the male pattern distribution. When the female hormones are high in the blood, but they're not acting enough on the target organs, which are the ovaries, then you have ovulation issues. And you also have irregular menstrual cycles stemming from both of these. So irregular menstrual cycles means they will hardly bleed, like they'll have less than 8 cycles a year, which means 2-3 months they may not bleed, or they will be over bleeding. They'll have too many cycles. All this will cause an issue with the lining of the uterus, which is the endometrium. So if you don't address these issues at the right time, what will happen is it might cause a buildup and eventually you might have abnormal cells growing in the uterine lining. Eventually that might lead to cancer. And yes, we do see patterns running in the families. And also it can eventually become a lifestyle disorder. So whenever we approach a case of polycystic ovarian syndrome, when she presents in your OPD, be it a gynec or in an infertility OPD, it's very, very important to address both. So surprisingly, we all start with lifestyle changes and guide them. And it's usually a teamwork. We don't work single-handedly. We work alongside nutritionists. We work alongside physicians because in case they already have developed diabetes or hypertension, it's very important to address it simultaneously. We work with physical therapists and coaches, trainers to help them lose body weight. And at this stage, we come in to regularize their menstrual cycles and to help them with fertility treatment. So that is why we say it is both a lifestyle disorder with a genetic underplay in it.
According to the World Health Organization, 8 to 13% of women in the reproductive age are suffering from PCOS. Out of them, 70% of the cases remain undiagnosed. A lot of women get to know about PCOS when they get married or visit a gynecologist for fertility treatment. Many symptoms of PCOS, such as painful periods or hormonal imbalances, are often normalized or dismissed as part of being a woman. This normalization can delay diagnosis and reduce the perceived importance of addressing the condition. Furthermore, the stigma attached to the physical changes in women pushes them to isolate themselves. Gagan Aluwalia, a psychotherapist who has been counseling women with PCOS and has been fighting the syndrome herself, has this to add.
One of the most evident things that we see with PCOS is weight gain. PCOS can also stop a person from putting on any weight. So they can be extremely skinny, but also have PCOS, but they can also gain a lot of weight and still have PCOS. And as we know that there is a certain fat phobia and body typing that is the norm that's propagated socioculturally, that there is a certain kind of body type that one must have in order to feel okay in their own bodies. Body image issues are quite common with PCOS. Another symptom of PCOS, which causes a lot of distress for women, is hirsutism, which is hair growth on parts of your body, like the face, the chin, your neck. And some women can have hair on their chest, on their bellies, on their backs. And that is also a grave cause for concern. And it creates a very difficult mental landscape for women to navigate, because there's often mockery and extreme and cruel bullying that teenagers can experience in schools and colleges. Because of hormonal fluctuations, there's also severe acne. A lot of times people need dermatological interventions. It doesn't go away on its own.
While the physical symptoms of PCOS are more detectable, the emotional and mental health impacts of the syndrome are often overlooked. This can lead to a lack of recognition and support for anxiety, depression, and other mental health issues. Women with PCOS may feel pressured to manage their condition without adequate support, leading to feelings of inadequacy or failure when they struggle. Dr. Saraswati Bhaskar, a well-known counseling psychologist and corporate consultant with over 35 years of experience, explains this to us.
Psychology is about thinking, feeling, and how we conduct ourselves. And those three encompasses the well-being. When we talk about physical well-being, it affects the body image and self-esteem. One feels bloated, there is pain or increase in cramping during the menstrual cycle. I'm talking about the physiological manifestations of PCOS. Irregular or excessive bleeding and having to change the tampons. Skincare issues. So definitely their self-esteem and the body image is going to be impacted, and they may want to seek some solution. And the brighter side to it is when they consult a gynecologist, they are recommending professional counseling, because these things lead to the emotional implications, which is anxiety, stress, sadness. I call it sadness rather than depression, because extreme sadnesses can lead to depression. So when I say mental well-being, I'm talking about how the thought process, the imagination, what is going to happen to me with this PCOS? Will I be able to have a healthy married life? Will I be able to conceive? Will I be able to have a healthy sexual intimacy? All those thought process can lead to some perceptions, which is interpretations of what they see, what they hear, and what they read, which can lead to probably nightmares, thinking of the worst. And sometimes I find with regards to the mental well-being, they begin to compare. They begin to compare themselves with ones who are healthy and put themselves in the victim situation of why me. And altogether, both the physical well-being and the mental well-being goes for a toss. And that really affects emotional well-being, which is accelerated fear, helplessness, mood swings. And there is also some sense of shame and guilt about if I had not done that, would I have not gotten PCOS? It could be anything. Using substances, using alcohol, indulging in activities that had causes some transmitted illnesses that was treated and cured. But you don't know, when you begin to wonder what has made me to get the PCOS, your mind goes all over the place, and that really impacts the emotional well-being.
Besides low self-esteem, women with PCOS also tend to have severe mood swings too, because of which they can face issues related to sexual health and intimacy.
Since it already has an effect on the person's mental and emotional well-being, physical appearance and everything, there are days and there are times when they do feel that they lack the attractiveness, they lack the feelings of intimacy because of the hormonal imbalance. And they do feel all these things because more of a dysmorphism and uncomfortable feeling about the whole thing rather than anything else. They are also prone to vaginal infections and things, candidiasis, fungal infections because of the hormone imbalance, because there might be a diabetes that they are suffering with alongside.
Dr. Saraswati Bhaskar explains to us.
Romantic relationships does take a toll because there is a shame of body image and self-esteem is low. So it's almost like face is the index of the mind. So what you think is projected in your face, and you may probably not be too forthcoming to establish social relationships or romantic relationships. Number one, for the fear of pregnancy, or if periods miss during the sexual intimacy, you begin to wonder, not sure whether it is because of PCOS, because PCOS, you do have either excessive bleeding or irregular cycles. So that can confuse, with the delayed periods and pregnancy.
PCOS is a crippling condition that affects a woman's identity, mental health, and overall quality of life. In persons with PCOS, stress, anxiety, and sadness are assumed to be multifactorial. Stress coping mechanisms are an important mediator in the relationship between the experience of stress and any mental disorders resulting from it. Coping strategies should be set in order to change, adjust, and interpret a stressful situation and reduce suffering. Let us hear more on this from Dr. Priya.
On one hand, we have to inculcate changes in lifestyle and diet, which our nutritionist and physical therapists will help. We also have a physician, who look into the metabolic aspect of it and issues that the person might already be having, like a high cholesterol or diabetes or hypertension. And on the other side, when you have all of these controlled and you're still looking to conceive or you're still looking to regularize your period, then we step in at that point. So some amount of medications are not at all harmful. Majority of it, yes, we can do it by lifestyle, but you will need at some point some support medically to address the irregular cycles.
Most women with PCOS have insulin resistance, which means the body doesn't use insulin well. Over time, Insulin resistance can lead to elevated blood sugar levels, weight gain, chronic inflammation, and diabetes. People with this condition also are at an increased risk of obesity and heart disease. Therefore, managing PCOS often requires significant lifestyle changes, including a strict diet and regular exercise. Anusha Santhana Krishnan, a clinical nutritionist with specialization in PCOS, women's health and cancer care, talks to us on the types of food that should be avoided to keep PCOS in control.
Mainly the foods to avoid should be all kind of sugary foods or the processed foods or packaged foods which are kind of too tempting, and also milk plays a major role in our PCOS symptoms too. Make sure the milk is not packaged. Make sure the shelf life of the milk is not more than 24 or 1 day at a time. Or you can source it from the dairy farmers so that you can get a fresh A2 milk which is not going to bother the PCOS.
Eating exotic fruits and vegetables has become a trend these days, following the belief that these provide extra nutrients. Advising people to eat locally grown produce, Miss Anusha says,
India has a lot of naturally grown seasonal fruits and vegetables which are actually very good in nutrients, and it's dense in iron and B complex which are necessary for the PCOS patients. But the thing is, the exotic fruits or vegetables has taken a lot of attention towards our market, like in the sense strawberries and blueberries are not locally grown. I know strawberries are locally grown, but the blueberries, we don't get blueberries here. Cost wise also it is very, very tough for people to get easily, and the accessibility is also very tough to get these exotic vegetables. And even the celery, nowadays you would have seen a lot of people drinking celery juice in the morning. Celery is very good for health, but the thing is, the sourcing of celery is very difficult because in South India, Ooty has a very good celery cultivation. But again, we don't get that in other parts. Instead, you can always alternate it with cucumber also. So you can drink cucumber juice or a lauki, something which is very rich in water.
As a clinical nutritionist, Anusha recommends to have a balanced diet.
People with PCOS should always consume food rich in protein. So the meal plate should have majority portion of protein, and then next portion should be a complex carbohydrates and some healthy fats. Never avoid fats. We cannot demonize fat because fat plays a major role in production of progesterone or female hormone. So you should always include a healthy variety of fats like ghee or coconut oil or coconut chunks to the food. Indian food contains a lot of carbohydrate, which is kind of simple carbohydrates and which can be easily spikes the insulin level in the blood. So make sure you combine a carbohydrates with a source of protein, in the sense like you can have jowar roti or bajra roti or ragi roti, and you can have a side dish of paneer or a sprouted dal.
Because of women's ability to procreate, it is generally accepted that if she suffers from PCOS and has infertility, it is her problem to cope with it. Emphasizing on the role of men in providing physical, emotional, and mental support to their wives, girlfriends, or partners, Dr. Priya says that men nowadays have become more protective and understanding towards their wives and partners with PCOS.
Men, they do have a very important role. But I think, in this culture and scenario, they take a step back and they want us to address the issues in a more comfortable manner with the women. But as couples, when they come to us for fertility treatment, that is when they are made to understand that this is a whole syndrome complex and, what the woman is going through, they get more educated. But I would wish that probably this education starts with siblings at home when adolescent PCOS come and the mothers at home are educated about it. The gynecologist educates the mother and the father about it, and they make the brother and sister understand what the sister is going through. Everything starts from home. So With the right kind of information, the boys will understand all about menstrual health, hygiene, and about conditions like PCOS, and they will be more empathetic towards the women in their life if they were to marry someone with a similar condition. They are not bad. Men are good. They will be definitely more supportive if they were educated enough.
Dr. Saraswati says,
I do not offer therapy just for the woman. She needs to come with her significant other, because dyadic coping is required. It is not just a she-her problem. It needs to be looked at us and ours for better coping and for the partner to extend that support. Even if there is any medical condition with regards to the men, it is covered up, but then the woman is blamed. So number one is not pointing finger at the wife or the girlfriend or the significant other, saying that it is your problem, and understanding more about the causes of PCOS and how it can be contained and what support that they can give.
Parents and caregivers play a crucial role in supporting young girls diagnosed with polycystic ovarian syndrome, PCOS. Dr. Saraswati says that parents should provide a safe space where their daughters feel comfortable discussing her symptoms, fears, and frustrations. PCOS varies greatly from person to person. What works for one individual might not work for another. Young girls should be cautious about using social media as a primary source for treating PCOS. While social media can provide support, inspiration, and a sense of community, it can also spread misinformation and unrealistic expectations.
This social media gives dime a dozen tips to follow, but definitely it is not like one size fits all. If someone wants to know what is workable for them, I would recommend to exercise better judgment in consuming this type of unregulated media.
The International PCOS guidelines advise that women of a normal weight should engage in at least 150 minutes per week of moderate intensity exercise. For women with PCOS who are overweight or obese, 250 minutes per week is encouraged. Exercise is an accepted tool for managing PCOS. The benefits of exercise for women with PCOS include enhanced glycemic control, enhanced self-esteem, and better management of body weight.
I'm a huge proponent of yoga and also a lot of physical training. I believe that you have to have an interplay of at least 3 different varieties of physical activity, starting with something that you can simply do at home, like yoga, or a gym assistance in the form of weight training, strength training, and cardiovascular exercises. Also, walking is a very underrated exercise, according to me. Like, people think you may not be doing enough, but you could do a lot of work just walking. And swimming, of course, meditation, and a lot goes into the food you eat.
PCOS is more than just a physical condition. It's a journey that affects every aspect of a woman's life, from her physical health to her emotional and mental well-being. Raising awareness and advocating for better support and resources are crucial steps in helping women manage this condition. Most importantly, PCOS is not the end of life. It is a way to live life in a more strategic and organized way by making small changes in the day-to-day living.
In the National Program of Features, you just heard a feature titled Silent Struggles, PCOS and its Impact on Emotional and Mental Health. The script was written by Ranjeni Singh and Meenakshi Mund. Narration was rendered by Vaibhav Srivastava. The program was produced by Meenakshi Mund. A presentation of the Central English Features Unit. This broadcast came to you from the Delhi station of Akashvani.